Okay, very good morning friends, very good morning students. Now we are going to talk about the next topic of that chapter number 2, that is the role of the state government in health. Okay, now students, here we will talk about the two different cases. We will study the two different case studies. Okay. So that's why I'll come out with this next video, and at the end also we will discuss the exercise. Okay, so first we will take the case study of the Kerala. Okay, we will take the case study of the Indian state Kerala. Okay, in 1996, students, in 1996 the Kerala government has made some changes. Okay, the government has made some changes, and 40% of its budget, okay, 40% of the budget the Kerala government has allocated to the health of the common people. Okay, 40% of the budget has been allocated to the health criteria, okay, to the health department to improve, in order to improve the health of the common people, okay, especially in the rural areas, okay, to improve the condition of the health centers, okay, especially in the rural areas. And they have made all the plans, okay, and they also provide all the requirements to the staff, like qualified doctors, nurses, okay. They have also made a lot of planning about to provide the safe and clean drinking water, okay, hygienic food, okay. These all the facilities they have provided to the health department, okay. Water supply is also checked regularly, okay, and working of schools and anganwadis, they also checked all these things, okay. So even the poor child also, even the small child also cannot be cannot remain poor health, okay. Even the small child's health cannot remain unhealthy or poor, okay. So all the things are checked and ensured properly, okay. And some of the health centers are also made and built in the rural areas, okay. And the previous and the running health centers are also improved, okay. So all these things improved the condition of the health centers as well as the public health in Kerala, okay. But apart from this, in some of the areas are still qualified doctors are not there, okay. The lack of qualified doctors, nurses, okay, and proper beds are not there, okay. Insufficient hospitals are there, okay. So these type of things are there in the Kerala, okay. This is only we have talked about the Kerala, okay. We have not seen the other places, or we have not talked about the other states of India, but hope very soon the condition of the health condition of the other states also will be changed soon, and it will be converted into a very good and improved condition of the health status of India, okay. Let's hope so. Okay students, so this much we have talked about the Kerala. Now we will take another example. Now we will study the another case study, that is about the other country, that is about the South American country, okay students. Here I am talking about the South American country, that is the Costa Rica, okay. I am going to talk about the Costa Rica, which is the most healthiest country of South America, okay. The Costa Rica is the most healthiest country of South America. Why? What's the reason behind that, student? The reason is very extraordinary and very unique reason is that, okay. No doubt that provision we cannot implement in our country, but definitely we can improve, okay. We can improve our condition by by taking the inspiration from this country, okay. So what they have done, students, from so many years ago, the Costa Rica government, okay, the government of Costa Rica country, they have decided, instead of spending money behind the army or behind the defense, we will spend all that money behind the health condition of the country. Okay, So they decided that we will not have our army, okay, we will not have our army, but instead of army we will have a good condition, good health condition, and we will provide all the good condition and necessary condition we will improve for our country's people. Okay, so they spent the money behind the health and education for the people. Okay, and they decided not to have an army. Okay, and according to them, the people needs to be healthy. Okay, according to the Costa Rica government, the people needs to be very healthy, and all the basic services regarding health should be provided to the common people. Okay, even the safe drinking water, hygienic living condition, nutritious food, all the things should be provided to the common people. Okay, sanitation facility, okay, all the things should be very proper, all the facilities should be very proper and provided from the government's end. Okay, and that's why they decided not to have an army. Okay, but this thing we cannot implement for the India, because army is also necessary for our country's protection. Okay, which the soldiers, okay, who can protect us, and that's why we can feel safe in our country. Okay, so we cannot remove the army, but at least we can improve the condition in terms of health. Okay, so that's all I want to say about the Kerala experience and the Costa Rica experience. Okay, students, now we are going to talk about the exercise, because now chapter is over here. Now I will talk about the exercise. Okay, so in exercise, the first question is what type of steps can government take to improve the health condition of the people? Okay, so here the answer we can say that, students, if the government want to improve the health condition of the people, then the public services should be increased, public hospitals, qualified doctors, a good infrastructure of the public hospital should be increased, and all these things should take place very carefully and with proper planning. Okay, then and only the health of the people can be improved. Okay, proper water supply, okay, sanitation facility, all the things should be provided to people. Okay, now next question is, student, we need to define the living condition and the public health. Okay, living standard and public health. Now what is the meaning of living standard, student? Living standard, it means whatever the minimum criteria that we need, the minimum facilities or the minimum necessities that we need for our survival. Okay, like whatever the financial requirements that we have for the good and hygienic food, for the pure water, okay, safe drinking water that we need. So these all the things, these all the necessities come under the living standard. Okay, so whatever the good living standard we have, that much our good public health will be there, that much good health we are having. Okay, then public health. Public health, it means what, students? Public health, it means the health for the all the common people of the country. Okay, the health for the all common people of the country, that is called public health. Okay, students, then next, water and sanitation facility is essential to improve the health of the people. How can we explain this sentence? So students, we can explain this sentence that like contaminated water, okay, by drinking contaminated water we invite so many diseases in our houses, okay, like diarrhea, okay, cholera, all these diseases are happened because of the impure water only. Okay, so water is very essential, a clean drinking water is very essential. Okay, and next is sanitation facility. Okay, so because of unhygienic condition where we are living, okay, that also causes many disease like dengue, malaria. Okay, so sanitation facility is also equally important. Okay, students, clear about this chapter? So refer all the videos once and take care. Thank you so much.